The Case Report Guidelines, commonly known as the CARE Guidelines, are an evidence-based framework for improving the completeness, accuracy, and transparency of medical case reports. Developed through international expert consensus, these guidelines give clinicians, researchers, and authors a structured way to present a clinical case clearly, ethically, and usefully for the wider medical community. Understanding the structure of the CARE checklist. In this episode, we are taking a closer look at the structure of the CARE checklist and why it matters in clinical writing. The checklist contains 13 primary items. Each item is designed to help authors report the patient's story in a way that is organized, clinically meaningful, and transparent. The process begins with the title and keywords. The title should clearly identify the work as a case report and indicate the main clinical focus, such as the diagnosis, intervention, or outcome. The keywords should support discoverability and should include the phrase case report, along with relevant medical terms. The abstract then provides a concise overview of the case. It should explain what makes the case unique, summarize the patient's main concerns and important clinical findings, identify the primary diagnosis and therapeutic interventions, describe the outcomes, and present the key lessons for clinical practice. The introduction sets the clinical context. It explains why the case is important, why it adds value to the medical literature, and how it fits within existing evidence. From there, the report moves into patient information, including de-identified demographic details, presenting concerns, symptoms, medical history, family history, psychosocial history, and relevant previous interventions. The clinical findings section describes the relevant physical examination and other significant findings. The timeline organizes the clinical course in chronological order, allowing the reader to follow the episode of care from presentation through diagnosis, treatment, follow-up, and outcome without losing the sequence of events. The diagnostic assessment is where the author explains the diagnostic methods used, such as physical examination, laboratory testing, imaging, and other investigations. This section should also describe diagnostic challenges, differential diagnosis, clinical reasoning, and any prognostic characteristics that are relevant to the case. The therapeutic intervention section outlines the type of intervention provided, whether pharmacologic, surgical, preventive, supportive, or self-care. It should explain how the intervention was administered, including dosage, strength, duration, and any changes made during the course of care, together with the clinical rationale for those changes. Follow-up and outcomes are equally important. Authors should report clinician-assessed and patient-assessed outcomes, important follow-up test results, adherence, tolerability, and any adverse or unanticipated events. The discussion should then interpret the case, address strengths and limitations, compare the findings with relevant medical literature, and explain the reasoning behind the conclusions. Finally, the CARE checklist encourages inclusion of the patient perspective when appropriate. This gives the patient an opportunity to describe their experience in their own words. The report should also confirm that informed consent was obtained before publication. The role and impact of the CARE guidelines. The CARE guidelines play an important role in strengthening the quality of medical case reports. They help authors move beyond simply telling an interesting clinical story. Instead, they encourage a careful, structured presentation that allows the reader to understand what happened, why it matters, and how the case may inform future clinical reasoning. One of the major benefits of the CARE checklist is completeness. When authors follow the checklist, they are less likely to omit essential clinical details. This makes the case report more useful for clinicians, educators, researchers, and journal reviewers. The guidelines also increase transparency by encouraging authors to explain diagnostic reasoning, limitations, outcomes, and adverse events. The CARE framework reduces ambiguity and supports a more balanced interpretation of the case. From a research perspective, well-reported case reports can provide early signals of effectiveness, unexpected harms, rare presentations, or unusual responses to treatment. These observations may later guide larger studies, clinical audits, or the development of research questions. There is also a strong educational value. Case reports support case-based learning by presenting real-world clinical scenarios. For healthcare professionals and students, this format encourages reflection on diagnosis, management, communication, ethics, and patient-centered care. Adaptations and specialty extensions. Because medical specialties have different reporting needs, the CARE statement has also inspired specialty extensions. These extensions preserve the core structure of the original checklist while adding field-specific elements that help authors report specialized clinical details more precisely. For example, the radiology extension focuses on case reports in which imaging findings are central to diagnosis or clinical interpretation. In acupuncture, reporting extensions may include details such as acupuncture type, point selection, treatment procedures, and treatment course. Other specialties have also considered the care framework because it is adaptable, structured, and clinically practical. Ultimately, the care guidelines help transform a clinical observation into a report that is clear, complete, and valuable. When authors use the checklist thoughtfully, they contribute to medical education, clinical reflection, and the broader body of evidence that supports patient care. As we close, the key message is this: a strong case report is not only about an unusual diagnosis or a memorable intervention. It is about presenting the patient's journey with accuracy, transparency, ethical care, and clinical purpose. Thank you for tuning in. If you found this discussion helpful, please like, share, and subscribe. This is the Everything Surgery Podcast, where we dissect the extraordinary.